Good morning, everybody. You can see on the screen if you're in the right place. We'll probably wait a couple of minutes for folks to trickle in, but really appreciate everyone being here and being on time. Good morning, everybody who's already here. Thank you for being here. We're just going to wait a minute or two to get started. We need to figure out that awesome background elevator music that some folks have figured out for their Zoom. So we'll work on that for next time. Okay, good morning. Uh, my name is Chad Bohorquez. I'm the Chief Program Officer of Destination Home and welcoming everybody here today to our November 2025 briefing about preventing homelessness in Santa Clara County. I'm joined by an amazing group of people who have been dedicated to preventing homelessness in this county for a long time. We'll hear from a lot of great folks today. Just really welcome you all here. Thank you for your interest. We have a robust kind of update and current progress of homelessness prevention efforts here in Santa Clara County, as well as an update on kind of the current state of funding for prevention efforts and just our environment at large. I'm sure if you're following the news, there's every day a new kind of worrisome piece of media coming our way. And I think that just right off the top, what's so encouraging about this effort, about preventing homelessness in Santa Clara County, is that it's nearly a decade in. It's been growing and growing stronger and having a measurable impact for some time now. So I know it gives me hope to be talking and sharing about a program that has worked for a while. Again, welcome. Just a couple of housekeeping. We are recording this session. Um, we have some panelists, and then we have folks in the kind of the general room. You can type questions into the chat, and they will be kind of facilitated toward the end of the meeting. We also got a couple of questions that were submitted as part of the registration, and we'll definitely be addressing those in the question section at the end. Um, with that, just want to kind of talk about why homelessness prevention is so important. Destination Home is really, I think, proud and grateful and honored to have helped start the Santa Clara County Homelessness Prevention System back in 2017 in collaboration with the City of San Jose, County of Santa Clara, some awesome funders at the time, like the Packard Foundation, Sunlight Giving, Google. We've since added so many awesome funders, Cisco, Apple, Stanford Healthcare, as well as some small cities in Santa Clara County, smaller cities in Santa Clara County, and just growing public sector support. And so we've really been, this is a true public-private partnership. Also, a huge shout out, and you will hear more from them as well as some of our partners. But Sacred Heart Community Service has been kind of the coordinating partner of a growing or network of organizations, nonprofit organizations that have been instrumental in delivering the homelessness prevention system since the beginning. So a huge thank you and shout out to them. Um, and it's all just to say that, in these times where we're seeing funding cut left and right, these are scary times. Just yesterday with the passing, kind of the reopening of the budget, which sounds exciting. It also came with some bad news as far as some of our funding in this sector. And so the homelessness prevention system, I think, is more important than ever. In fact, there's an argument to be made that like our only way of ever truly ending systemic homelessness in the United States is to start leaning into prevention efforts more than ever. For us at Destination Home, to honor that or to represent that, we continue to raise and commit private funding to the homelessness prevention system. We're committing approximately $4 million in the current fiscal year to this prevention system. And this is 8, 9 years into the system, and we still feel like that's one of our major investments. So with that, I'm going to pass it to Hillary with the county's Office of Supportive Housing because today the homelessness prevention system is run and operated by the county itself, and that's a huge success for our community. So Hillary, take it away. Thank you.
Thank you so much, Chad, and thank you all for being here today. I know that some folks may have to come in and out, but this will be recorded and we will share the information with everyone after the webinar today to make sure you have all the material. As Chad said, I'm Hillary Armstrong. I'm a Deputy Director with the County of Santa Clara Office of Supportive Housing. And as part of that, I have the privilege of working with our homelessness prevention system and team here at OSH. It's also like coming home for me because back in 2017, when this pilot started, I was a legal services attorney working at the Law Foundation of Silicon Valley. And we were one of the early partners, and the Law Foundation remains a legal services partner for this effort. So I'm just thrilled to be able to share with you how the system has grown. We're going to move on to the next slide. And as Chad set the stage, we really had a crisis that was being driven by inflow of folks into homelessness. We knew that we needed a strategy to keep people housed before they became homeless. And we believed that this would not only save costs, but also reduce suffering, reduce the trauma of homelessness, and really just provide for a much stabler and healthier community. And so the idea for this system was kind of born at that time. And just where we stood at that time, in 2016, we had more than 5,000 households who experienced homelessness for the first time. So at that time, every one household that we connected to housing, we had another 3 becoming homeless. And so this inflow problem was really reaching a peak level. And at that time, in 2017, under the leadership of Destination Home and the public-private partnership, we launched a small homelessness prevention pilot. You can see in the 2017 pilot, it had a budget of $1.6 million. And later on, we'll talk about where we are now. And a capacity to serve 215 households. So I will say now we are at more than 10 times the budget and capacity of when we started. So it's just a really great evidence of scale. And at that time, it was primarily privately funded. And you could go back to that slide, sorry, Esme. And the public funding was about 1/3. And now that has shifted as we've brought more and more public funding and leveraged more public funding sources. We also wanted to share with you how much the system has grown. And so you can see kind of each fiscal year, the growth of our system. And in the last couple of years, we've been able to serve a capacity of around 2,500 households per year, give or take. And part of what we want to talk about with the next slide is just the scope of these services. And so it's really astounding to think about the number of people within these households who've received prevention assistance since the launch of this system. And we also wanted to flag that having this system in place was huge during the COVID-19 pandemic because it gave us a network and an already established system in which to quickly pivot to delivering the pandemic aid, which is also the COVID-19 related assistance is included in this incredible number of folks who've received services. And so we understood the need to really scale. And we're also happy to say that the results of this program are just really incredible in that 93% of families remain stably housed 2 years later. And living in the second most expensive place to live in the entire country, I think that really is an astounding result when you think about it. And 1 year later, only 6% of households became homeless. So really, these are families and individuals who were very much on the edge, at risk of eviction, at risk of losing their housing and becoming unhoused. And we were able to prevent homelessness, prevent that trauma, and prevent the added costs on all of our systems. I see a question from someone that I just want to address here. The 43,000 number is individual people. So they make up households, but if there was a household of 6, we count all of them because it prevented homelessness for all of them. So thanks for that question. All right, next slide. So I think the other thing that Chad alluded to that we wanted to share with you all is that our homelessness prevention system started as a pilot and is we integrated into our broader system response. This slide has a lot of detail, so we'll send it out to all of you. And we will provide the slides after, but we just wanted to situate for you how homelessness prevention relates to all of the other components of our system. And so, by providing rapid financial assistance, case management, legal services to folks most at risk of losing their housing, we actually hope to prevent their entry into some of the other programs here on the left, like the need for shelter, the need to enter through our coordinated entry system to be matched to housing programs, and basically to keep folks housed where we can and to help them move to more affordable housing with rental assistance to tide them over so that they don't enter homelessness. We also wanted to situate for you how homelessness prevention is one pillar and affordable housing development is another key pillar that our office and all of the partners on this have been deeply invested in. And without both pillars, I think that we would not see the successes that we have seen to date. So with that, I am going, I believe, the next slide. Oh yeah, so we just wanted to share with you in terms of our inflow that we have really begun to narrow that gap. I think the challenge remains. Our goal is to reach functional zero in that we have permanent housing and are moving folks into permanent housing at a higher rate than new households are becoming unhoused. And so that is our ultimate goal. We are clearly not there yet, but we have narrowed that gap significantly since 2016, and our very robust homelessness prevention system is a huge part of that. All right, with that, I'm going to pass it over to Cupid Alexander from the city of San Jose to talk about some San Jose specific information. Thank you so much. I'll be
Thank
back.
you, Hillary. Thank you, Hillary. Good morning, everyone. Cupid Alexander, Deputy Director of Housing, focused on the homelessness response here in the city of San Jose. And I wanted to take a step back. I actually wanted to start with a quote that defines this system. And it says, and I know many of you have heard this, you don't rise to the level of your goals, you fall to the level of your systems. That's James Clear from Atomic Habits. And I bring that up because it reflects exactly why San Jose and Santa Clara County are aligned in this work. We have all the same goals, reduce inflow, stabilize families, prevent trauma, and ultimately end homelessness or get to functional zero. But goals alone don't change those outcomes. What changes outcomes is the system that is built together. I do want to call out what Chad was talking about. I know a lot of us have anxiety. I do want to recognize that in this space, which is why this system is so important. And the reason why we're seeing the measurable progress we have, the real trackable movement, is because our systems are aligned. Our outreach systems, our screening systems, our data systems, and our prioritization systems are now pointing in the same direction, and we're trying to point even better in the same direction. That alignment is what allows us to intervene early, reach deeper, and stabilize households before a crisis becomes homelessness. And it's the most cost-efficient way to do business. So some of the things that I wanted to point out on this slide, it shows the scale of the challenge, and it shows why this alignment matters. So San Jose represents about 77% of the county inflow. That is almost 3,200 households who completed an assessment for the first time last year. 3 out of 4 newly homeless households in the county live within the city of San Jose, and the data tells us 2 things. First, San Jose faces some of the highest housing pressures in the region: cost burdens, rent increases, income volatility, all of which drive vulnerability. Second, prevention in San Jose affects the entire county-wide system. This is why prevention cannot be an afterthought. No matter how many times and how many units we build beds or we add them, we will not outpace inflow unless we keep families housed in the first place before they become homeless. And I want to take a moment also to recognize so many of the different staff members, our staff. Many of you are on this call. We can't do this work without you. I wanted to be sure that I gave that shout out because so many people are committed to this work. The outreach teams, the navigators, the analysts reading this data every day, the nonprofit partners doing this work, the caseworkers answering the calls after hours. So many times we overlook their work. It is critical to this system. I am just saying thank you very publicly because we can't do this work without you. You are the ones reaching deeper into vulnerable households, using data to guide the intervention and stabilizing families in this crisis before the crisis or sometimes after the crisis hits. Because of that work, more than 5,447 San Jose households have avoided homelessness since 2017. And that number isn't just large, it's really meaningful. It represents children who stayed in their schools, workers who stayed connected to jobs, families who stayed rooted in their communities. And importantly, this progress reflects alignment. The city and the county are aligned in how we identify risk, how we prioritize resources, and how we track that inflow. And that will be more important depending on how the federal government and the administration administer ongoing resources. Our data is systems are sharper, our screening processes are more targeted, and our outreach is more coordinated than at any point in the past decade. And I think that that is great. And the data shows it. When we stabilize families upstream, the entire ecosystem experiences less downstream strain, fewer shelter intakes, fewer emergency responses. So on this slide, this next slide reflects where our prevention system stands today: more coordinated, more intentional, more deeply informed by data than ever before. We are aligning outreach teams, syncing screening tools, coordinating service pathways based on the data. It tells us about early instability, late red flags, utility arrears, medical crisis, job disruptions, and high-risk zip codes. I think one thing is clear. Prevention is both evidence-based and cost-effective. It costs significantly less to stabilize a household upstream than to rehouse them after a crisis. And the human outcomes, especially for children, I don't want to overlook that, are dramatically better. And again, I want to acknowledge our staff, the way that we're doing outreach, the deeper the outreach, the ability to find those households who are isolated, hesitant, or fearful of the systems. I do want to call about the fearful of the systems, are unaware that help exists. We're finding them, we're connecting them. This is very human work. We're centering them. I'm really proud of that work, and I'm proud of this alignment. It requires our listening, our patience, and our trust. The city of San Jose continues to stay committed with our local investment in the system, ensures that we can respond quickly. And I think that is about it that I wanted to bring up. I believe, Hillary, it goes back to you, but I just wanted to reiterate that we've seen that the system is effective. We will continue to evolve with this work together, and then we will continue to manage and monitor the outcomes, especially in light of everything that's going on with the federal government.
Thank you so much, Cupid, and thank you to the city of San Jose, who are an incredibly steadfast partner in all of our efforts, in a core funder and system partner for prevention. And we also want to acknowledge the participation of the other 14 cities in our county, and including the city of Santa Clara, which we'll talk about as a funder of prevention. So just really grateful for that partnership And also thank you, Cupid, for highlighting the unique pressures that San Jose residents experience, as well as the core nature of prevention. So with this, we wanted to transition into an overview of our current countywide homelessness prevention services. So we're going to talk a little bit in high level about how the system works, and then you're going to get to hear from people on the ground, which is going to be great. So we have an array of programs and services under the larger umbrella of homelessness prevention. And this, like our broader supportive housing system, really helps us recognize that there is no one-size-fits-all solution. Folks come into the risk of homelessness or experiencing homelessness from a variety of different backgrounds. We'll talk a little bit when we hear from Sacred Heart about the main reasons that folks seek assistance, but recognizing both kind of the different reasons that folks are at risk of homelessness and the different levels of need that they may have to resolve their homelessness, we have this array of programs. And the main program that we're highlighting today is our kind of signature, started with this pilot homelessness prevention system. And this is our national model, which we'll talk about a little bit later, for robust, rapid, and flexible financial assistance that includes legal support, that includes case management, and it's typically provided over a period of time. And I can tell you back in 2017, when this pilot was starting, this was a game changer because as a legal services attorney, working with low income folks who were facing eviction or at risk of homelessness, there were like really great community partners in place, but almost all financial assistance was kind of either a one-time or somewhat limited in terms of being able to pay for first and last month's rent, and did not include, kind of the direct connection with necessarily with case management, with flexible funding, and the ability to continue that funding over a period of time in order to stabilize a household. And then certainly not with legal services to help resolve an eviction. And having an eviction on one's record, as I'm sure you all know, can be very, very detrimental to seeking further housing. So this program is really a robust and highly successful program for families and individuals that have, kind of a high level of ongoing need to be to help them stabilize and avoid homelessness and avoid kind of homelessness system, entering our system and in the trauma of becoming unhoused. We also have some unique partnerships, sorry, I'm still on this slide. I promise we'll talk all day, with our Wellness and Housing Stabilization Program, which provides direct referrals through our partners in the behavioral health and substance use treatment system. And so these funds are uniquely targeted to households who have an individual who's experiencing serious mental illness or who is struggling with substance use issues. And so the idea is to provide these targeted funds. It's a referral-based program, and it follows all of the same robust processes and kind of wraparound services as the overall homelessness prevention. And then we have our emergency assistance network, which provides one-time cash assistance and case management. And so this is really kind of that more short-term intervention. And many of the EAN partners are also partners of our homelessness prevention system. And so this can be for someone whose issue is really just very circumstantial in a particular moment, like they're in between jobs, but a job is lined up or similar, or face a large amount of medical debt in a certain period, but just needs some one-time assistance to get back on their feet and stay stabilized. And so overall, you can see the capacity of the various programs, and we aim to serve more than 2,500 households annually, which was a goal of our 2020 to 2025 community plan to end homelessness that we have reached. You can see here that homelessness prevention provides the biggest portion of those, but that we do have significant capacity in each of the other programs as well. Next slide, please. So we also wanted to go over the budget. This is something that is on the top of everyone's mind. And as I shared at the beginning, when this started as a pilot, the funding was primarily from the private sector, from philanthropic donors. That Destination Home worked to convince that this pilot was worth trying. And at this point, you can see it's really shifted. Destination Home remains a core funder through their fundraising efforts and still provide 15% of our annual funding, which is critical. And that funding also helps us where any other funding sources, if they have restrictions on who they can serve, just to be clear, our system is open to all, regardless of documentation status or other underlying status concerns. And so having those private funds can help us where other funding sources might be more restrictive. So we also just wanted to share, and you can obviously look in greater detail, but our funding really comes from a great variety of leverage sources. So the City of San Jose is a key funder, and thank you all for your support through the Measure E, which was approved by the voters through their Housing Trust Fund. The City of Santa Clara also provides funding. And then you can see the number of funding sources that the county is leveraging, including state homelessness funding through the HHIP AP program. We work with our Medi-Cal managed care plans here in Santa Clara Family Health Plan and Anthem through the Homelessness Housing Incentive Program, HHIP. And we have funding again through the Mental Health Services Act, the state competitive grant for the Family Homelessness Challenge Grant. We have American Rescue Plan Act funding, we have CalWORKs funding, and general fund from the County of Santa Clara. Next slide. I'm going to hand it over to Erin to talk more about the people. Thank you so much.
Thank you, Hillary, and good morning, everyone. Thank you for joining us today. My name is Erin, and I work on the network coordination team for the Homelessness Prevention System at Sacred Heart Community Service. I'll talk a little bit more about the role of Sacred Heart and our other partners in a bit, but I want to start by talking more about the Homelessness Prevention System, or you might hear me refer to it as HPS for short. HPS targets people while they're still housed, but they're about to lose their housing and they're at great risk of becoming unhoused. And we define that in our eligibility criteria as being within about 14 days of either losing your housing or missing a rent payment that could cause you to lose your housing. So most often that means people are coming to us because they can't pay the rent and they're at risk of losing their housing. They might already be in the eviction process. They might also be needing to leave their housing because it's unsafe, perhaps due to domestic violence or other safety issues in their home, or for any other reason that they need to leave the place where they are currently housed. The folks that we see in HPS, about 86% are people of color, 72% are women-led households, 57% families with minor children, and almost 20% are older adults who we see in HPS. And the number one reason why we see people, why people come to HPS, why they're at risk of losing their housing is because income is not keeping pace with rent. And this has been the number one reason far and away since the day we started HPS in 2017. There are many, many factors that may contribute to housing instability of risk of homelessness, but it consistently boils down to the ability to pay the rent. A lot of that is systemic, right? We do not have housing that is affordable in our community. Wages don't keep up with the cost of living. Benefits don't keep up with the cost of living and aren't there for everyone who needs them. And so this is really kind of a primary driving force in what's happening in our community and why people are losing their housing. We do also see other, key factors contributing and showing up in the folks who are facing this situation. 46% of folks experienced homelessness in the last 3 years. Pretty consistently, we see that a prior experience of homelessness is one of the key risk factors for becoming homeless again. 29% of folks have a history of incarceration and are facing all of the barriers that come with that to employment, to housing, to stability. And 35% are survivors of domestic violence. There's a very high correlation between facing domestic violence and being at risk of homelessness. And this is our network. So HPS it's a network. This is a big program. This is not something that any one organization could do on their own. We have over 20 organizations that participate and support HPS in some way across Santa Clara County. This is really critical because we need the capacity to work with thousands of households. We need the geographic reach to cover a very large county. We need the connections to local communities to be a trusted partner to work with families, and the experience and expertise to work with different families in different places with all different situations. So you can see we have a really broad network that bring really great depth and a variety of experience. And we have our domestic violence advocacy consortium partners who specialize in supporting survivors of domestic violence, as well as our legal services providers who really focus on the legal side of things, especially related to evictions. Now I'm going to talk a little bit more about kind of the nuts and bolts of what we do. So I work at Sacred Heart Community Service, and Sacred Heart serves two roles within the homelessness prevention system. We are the network coordinator, which means that it's our job to coordinate between all of the many, many folks who are involved in HPS, the funders, the system partners, all of the partner agencies that you saw on the prior slide. We coordinate and we support all of those partners to work together, providing HPS consistently across the county. Sacred Heart also is one of those partners providing services. We have another department at our organization called the Family Assistance Team that serves as one of the service providers for HPS. So we fit in both those places. Everything that we do in HPS really goes through the lens of our philosophy that we created early on in our work. I'm not going to go through every detail of this. You can read it on the slide, but just to highlight a few things, a lot of this relates back to flexibility. HPS is not a one-size-fits-all program. We don't do the same thing for every household. We work with each household individually to develop and customize the services that they need. And that's really kind of the hallmark of what we do, and one of the things that really makes HPS different from a lot of other programs. We also prioritize. We do not have the capacity or resources to assist every household at risk of homelessness in Santa Clara County, not even close. We turn away hundreds of households every month who are scared that they are going to lose their housing. So in order to do that strategically, we try to prioritize and use an assessment tool to prioritize serving those who are most vulnerable and most at risk of losing their housing. And we also do strive to advance racial equity in everything we do. We use our data, we use feedback from our participants, we learn from the expertise of those who have been through our program and have lived experience with housing stability and homelessness to continue to strive to make our work better and more responsive to address the inequities of housing instability and homelessness in our community. So what do we actually do? What does that actually mean? What does a household receive if they come to HPS? We provide financial assistance, case management focused on housing stability, and housing-related legal services. So financial assistance is primarily it's housing. We're paying the rent. You saw the number one problem, people can't pay the rent, we pay the rent. We provide flexible financial assistance. It can be used for other things. Most of the time it goes to paying the rent, but we address barriers. We can pay for a car repair. We can pay for childcare, things that are barriers to stabilizing housing. And that financial assistance, the amount and what it is for and how long we provide it is based on each household situation and the individual housing stability plan that they have to stabilize their housing. And that is developed and supported through case management, where the case manager can really be flexible and do whatever it takes for each individual household to stabilize their situation. And then we bring in our legal support when there are housing related legal issues. Most commonly, that is when someone is facing an eviction. Folks can access HPS through our central phone line and email, or by going directly to any of our partner agencies. We also do have staff attending eviction court a couple days a week to try to support folks there. And our basic eligibility is that you do need to be a resident of Santa Clara County. Being at risk of losing housing or current housing is unsafe, which is that kind of 14-day definition I mentioned before. Low income, under 80% of area median income. And then we use an assessment tool to prioritize, and we serve those who are considered highly vulnerable based on the assessment tool. As I mentioned, our financial assistance is very flexible. Some folks need very little, some folks need a lot. It averages out to a little under $6,500 per household. Same thing with how long folks work with us in terms of how long they're receiving financial assistance, how long they're receiving case management or legal services. But that averages out to about 5.5 months. And we have found through our years of doing this work that it works. 95% of families remain stably housed while receiving services, either in their existing housing or by moving to new housing. And so they were able to avoid homelessness. And we find that there is also, even though it's a temporary assistance, there is a lasting benefit. If we look at households who were housed at the time they completed working with us, a year later, only 6% have become unhoused, and 2 years later, only 9%. So we do see that lasting impact over time. And finally, I just want to quickly note that, there's still work to do. We are learning and growing and building the system as we go, and we're still doing that. We're not there yet. We haven't got the perfect system in place. So we're constantly trying new things and assessing and evaluating and what we're doing. There's several examples on here. I don't want to take the time to go into all of them right now because I know we have a lot of other content to cover, but feel free to review them or ask if you have any questions. And I will just note that one of the things that's on here is expanding our network to agency partners. And while we don't have the capacity to add new partners all the time, when we do, we really look to expanding our capacity and filling gaps in the network. And so I'm really excited to now pass it off to our newest partner in the HPS family, which is Bill Wilson Center. So I'm going to pass it off to my colleagues, Jade and Benaifer. Thank you.
Thank you, Erin. Hi, I'm Benaifer Dastur, and I oversee the rapid rehousing and the homeless prevention program in Bill Wilson Center. As you can see, I'm not going to read all the programs, but Bill Wilson Center has been serving the community since the past 50 years. On any given night, Bill Wilson Center houses over 900 clients across all its shelter and housing program for youth and families. Bill Wilson Center, until recently, did not have a homeless prevention system. And we saw that as a huge gap since we could see the need in the community through calls and emails that we would receive, families reaching out to us, fearful of being homeless, struggling to pay rent due to some circumstances beyond their control. Partnering with the Office of Supportive Housing and Sacred Heart, Bill Wilson joined the Homeless Prevention Network in May 2025. Just in the span of 6 months, we could see the overwhelming need. We served 63 households, and majority of them were families with children. Next slide, please. We were able to prevent 11 evictions in this short 6 months and help those families who were on the brink of homelessness to stay housed. I would now like to pass this on to Jade Bradley, who's our program manager for the Bill Wilson Family Homeless Prevention System. And she will share some insights from her interactions with the clients directly.
Thank you, Benaifer. Again, my name is Jade Bradley, and I am the program manager here that oversees the HPS program. So the demand for emergency assistance has risen over the past few months. The Bill Wilson Center has observed that the need is especially high among households with one adult that is employed. When a single income earner experiences a job loss or reduction in work hours, medical emergency, the entire household becomes immediately vulnerable, often unable to make up the basic expenses such as utilities, food, and most critically, high rent. I'm going to go into a little bit of a story of a client who came to the Bill Wilson Center. His name is Jesse. And after he lost his job, Jesse worked as an Uber driver in order to support his family, which included a 2-year-old and a newborn. But his income wasn't enough to keep up with the high rent that he was paying. When he received an eviction notice, he feared becoming homeless, and with that, his children. Through the Bill Wilson Homeless Prevention Program, Jesse was connected with the Law Foundation to help navigate through the eviction process. Together with the Law Foundation, he worked with the property management and when he was able to cover his overdue rent, allowing him to stay in his home. Soon after, Jesse secured full income employment as an assembly technician in robotics, and he now makes over $6,200 a month, enabling him to support his family. Recently, I caught up with Jesse, and he wanted me to share a little bit about what the assistance meant to him. He says, "I lost my job and almost lost my apartment. It was a really tough time, but I wanted people to know that searching for help, that there are people and programs out there willing to help. You just have to stay consistent, put in the work, and not give up." He says now he's back on his feet and he truly appreciates the support that we have provided. Jesse's story reflects the reality of many families and individuals who are just one job away of losing their housing and or their expenses. And it really was such an amazing time meeting with Jesse, because I'm so happy that he was able to keep his housing. And right now he currently has moved out of the county and is living in Union City. So I'm going to send this back to Chad. Thank you.
Thank you, Jade. Well, this is always the part of the presentation that I like to say, well, you don't have to take our word for it. The University of Notre Dame's Lab for Economic Opportunities actually studied the Santa Clara County Homelessness Prevention System from when it very first started in 2017, July, all the way through to the beginning of COVID, where they felt like circumstances had changed, as we all know, so much that it was no longer kind of valid to keep going. So what they found, and they actually published this in a 2023 MIT journal, was that folks who did not receive the assistance, which again, the primary intervention of this assistance is rapid financial assistance and then support thereafter, are 3 times more likely to experience homelessness, which is staggering, and a kind of a clear-cut case for such a cost-effective intervention. And there's also a cost benefit. So a lot of folks on this call especially are working on budgets and kind of making a case for what are the most cost-effective interventions that we can use our limited dollars on. And they found, and this is looking at all kind of related expenses for someone to be homeless versus to be prevented in homelessness, that for every dollar spent on emergency financial assistance, there was $2.47 benefit. Next slide, please. And because we've been at this for a long time and we've talked to many communities and we've really tried to find a way to codify all the different experiences and how the mechanics of the system work. You know, we scratched the surface today. Erin and her team and experience, you know, have built out like a very robust, thoughtful, and strategic program. And so we try to capture this whole experience of building and growing the homelessness prevention system into a toolkit. You can scan it here. We'll also put the link in the chat, but this is a free resource available. It's been kind of circulated throughout the country. Please check it out. There's sample documents of our policies and procedures and all kinds of detail in this toolkit, and it's available for free so you can learn more about how the system works. Next slide, please. With this, I'm going to pass it back to Hillary to take us home, and we'll get into Q&A soon.
Thank you, Chad. We wanted to give you a quick update about the impact of some federal policy and budget changes on our community, with the caveat that this is rapidly evolving. And as Chad alluded to at the beginning of the call, we are hearing reports, and there's a New York Times article today about kind of the continuum of care program funding for our overall homelessness system. And so we can talk a little bit about that in the Q&A. But with the next slide, we wanted to highlight what we know for sure, which is that the impact of our federal administration's, the passage of H.R. 1 in July, is leading to a loss of probably more than $1 billion in revenue to the county. And when we hear revenue to the county, that is actually safety net services. So that is Medi-Cal benefits, and that is food assistance for the most vulnerable folks in our community. So to put this in context, we looked at the households that we've served through homelessness prevention in last fiscal year. 70% of those households rely on Medi-Cal benefits for access to healthcare. And, through case management, that number could be even higher because folks through their HPS connections may actually get connected to benefits. Similarly, almost half of households rely on SNAP or CalFresh benefits to put food assistance on the table. And I think, with the government shutdown and the discontinuation of SNAP payments, we saw that critically in our community just over the past couple of weeks. And we will see this ongoing as different work requirements and restrictions and changes in funding reduce the folks who are able to access these benefits and reduce the payments. And the most vulnerable folks are the ones who are impacted by this. So you can see here that seniors make up a fifth of the folks that we serve through homelessness prevention. People with disabilities make up almost half, and women-led households are 3/4 of the folks that we serve. Those are the folks who are also most vulnerable to these cuts. And, I think this just is one very specific example of the difficult environment that we're in, but also the opportunity for us to really leverage this locally grown program that is incredibly flexible and incredibly effective, as you've seen, and able to leverage funding from a number of different sources and can kind of pivot with the moment. So with that, I think we're going to pass it back to Chad and get into some of the great questions that y'all have been posing.
Thank you. Ooh. Can we take the slides down, please? Awesome. Okay, great. Thank you so much for everybody who shared today, all your expertise. We're going to start with the questions that were submitted through the registration. Some of them have been answered along the way, as well as some of the Q&A, but we'll try to get to everybody's questions, I should say. If we can't, we'll find a way to follow up. But just really appreciate all the engagement and interest about learning more about homelessness prevention. So the first question that was submitted is, how is sustainability of the prevention system being achieved over time? And for that, because, from Destination Home's standpoint, our sustainability strategy was to get the county to really own and take over the homelessness prevention system. So from there, I'm going to pass it to Hillary to answer from that point on.
Thanks, Chad. Yeah, I think it's all of the above. So I think it's recognizing that this program has always been a public-private partnership, and that there are opportunities to leverage many different kinds of funding. And so I think that as public sector partners, first of all, just owning this program as a critical part of our response to homelessness in our community, as a critical part of our overall big supportive housing system to prevent and end homelessness in our community, and situating it within the county and the county-wide kind of geographic scope. With that, I also wanted to touch on, and Chad, you're probably getting to it, but I saw some questions about how we serve folks in different cities. And so to be clear, this is a county-wide program. And the great part of it living at the county and with the network coordination team at Sacred Heart, and then the backbone support of the City of San Jose and Destination Home, is that in leveraging all of these funding sources, it's seamless for the participants. So a participant just goes through the assessment, finds out if they're eligible, and then gets the service that they need. And then our team at Sacred Heart is looking on the back end to see, how are we funding this? So it's not a burden. I think, Cupid, the quote you said at the beginning about kind of the way we design our systems, we're really trying to focus the experience on the families and households that we're supporting. And so because of that, we are serving folks from across the county. So individual cities are welcome to, and we very much appreciate contributions to this, especially as times get more and more difficult, as you can see with the budget. But it doesn't mean that we are serving folks from every single city in the unincorporated areas, and that allocation of resources is according to need. And so that is how we leverage all of these resources. And that's how we will sustain this going forward, is by working with our private sector partners to get that flexible funding when government funding is more and more difficult, by advocating with the state and advocating with anyone who will listen in the federal government about the critical nature of prevention and to make sure that our statewide funding sources can fund prevention.
Thanks, Hillary. I'm really glad that you did address that. And I think, from on the program side, like our really hope is that the system is as equitable as possible, right? Like we're prioritizing the resources and like the ability to help people based on the need, not on any kind of geography, et cetera, which is, really one of the features of this system that was really meant to address kind of some old ways of doing things, which was, to set aside funds for certain areas. Now we're really and again, Aaron and Sacred Heart and the team of nonprofit organizations has like highly coordinated to serve whoever is the most vulnerable people, regardless of which organization is addressing that. So the next question is, and this question is the other elephant in the room, and I think we tried to address it here towards the end of the presentation. But with the impacts of HR1 and other likely budgetary cuts, which homelessness prevention programs are most at risk of being cut? Well, it's a twofold question from my perspective because something that Destination Home continues to work on is that there are no federal funding sources for homelessness prevention. So perhaps we won't be having to face federal budgetary cuts for homelessness prevention per se. But that also indicates why this is so important to continue to grow this movement and grow this effort because someday we want to have federally funded prevention efforts. The other reality is that we'll be making some difficult choices locally about what we have to fund. But all I can say right now, because we don't have some master plan that's already worked out. Things are trickling down in real time, but like we are all going to have to work together to address this. And like we hope that everyone on this call can be part of that solution and that we can make these difficult decisions together on how to serve our community. I'm going to jump to the next question. What ways can we secure permanent and expanded funding for this program so that at least half of applicants receive funds? Awesome question. I'm going to pass it to you, Cupid, first, and then if you want to pass it to Hillary or anybody else after that.
Yeah, from our perspective, it's a financial analysis that we're doing to see what is needed. And so I think the difficult conversation that we'll have to have is what is the level of support that people need? What can we offer and how can we leverage additional resources? So that's an ongoing conversation, but I don't want to leave this space without saying that that's the difficulty in determining what someone needs, and not everyone's level is going to be the same. Sometimes there's a financial analysis. So taking that 6,000 number that Aaron used in the earlier in the presentation and looking at how many people that would be a simple math equation, or we're going to have to look at the level of subsidy or the level of assistance. So that's all to say we will have to take a look at the programs and the system within itself to see where we can effectively assist individuals. And we know with the reduction of resources, we're going to have to be really targeted. So I know that that's a conversation we'll have with this team, COC, all these different rooms, but it's an uncomfortable conversation that we need to have as a group, as a team, as a family, to indicate what is needed, how much is it going to assist, and will this effectively keep someone housed? Otherwise, we're just going to have to be a little bit more targeted. And also, shout out to Chad and his room, by the way. I just wanted to put that out there. I know you all were thinking it. I'll hand it over to Hillary.
Thanks, Cupid. The only thing I would add is in terms of funding sustainability, we're working closely with our intergovernmental relations at the county and any kind of networks we're tapped into for legislative to really promote the use of, in particular, state funding sources to be eligible for paying for prevention services. And if they are already eligible, but there are certain things like it has to be for a minimum of 6 months or that sort of requirement, making sure we can advocate for some flexibility in those sources.
Thank you both. Next question. This question, maybe is a little bit alleviated, at least until January 30th, but the reality is it's an ongoing concern. And so the question was, are the homelessness prevention system organizations planning to organize to prepare for the discontinuation of SNAP? And if so, how? And what I want to say is like food insecurity and other safety net, insecurities and connections is like always a theme of the folks that we're serving. And one of the benefits of continuing to provide flexible funding, private, corporate, philanthropic funding to the system mixed with all the public sector funding is that we have the flexibility in this system to pay for any essential needs, and sometimes that includes food. And I also wanted to pass it to Erin just to talk about like what Sacred Heart and other organizations are doing around food insecurity right now.
Thanks, Chad. Yeah, I think this is definitely a hot topic these days, and there's a lot of conversations happening among not just HPS, but all of the community service providers who are focused on food security. This is a really huge issue. And there's an advocacy component, and there's also just a meet the need locally as much as we can component. Definitely some local folks are stepping up, and there are a number of ways to access food in our county through food pantries at Sacred Heart, at many of our other partners. So on the day-to-day in HPS, that's often really our focus is we are working with families who need to feed themselves. And so if benefits are not available, obviously that's something we want to connect people to if they can get them. But if not, how can we make sure they're connected to other local sources to make sure they have food on the table? And we are fortunate to have a lot of community partners who are working on that every day.
Thanks, Erin. And I'm actually going to stick with you. And there was a question about other types of supportive services that are supported through other prevention efforts, things like addiction recovery and other programs that kind of help support people.
Yeah, great question. So in HPS, when we work with a household, they are kind of figuring out what they need to stabilize their housing. And we're pretty laser focused on the housing, but there's so many contributing factors that a big part of the case management is how do we connect people to other community resources to address those other contributing factors. So that could be addiction recovery, that could be education, healthcare, things they need like transportation or childcare. So it's really looking at that whole picture, and then we do what we can do, and then we connect to all those other community resources for everything else. And some of it is really some of it's more formal. It's getting folks, helping them navigate a referral system or a process, right? A lot of those services are there, but they're hard to access for all sorts of different reasons. And so helping people navigate and connect. And then some of it is a little more informal too. Sometimes it's helping people think through how to better get support from their social network or their family or friends, and just really be that kind of person side by side helping problem solve and figure out the solutions to all these things that come up so that folks can maintain their housing.
Thank you. Next question, and it may have come up in the presentation, but I do think it's super important. Can you share the difference in costs between prevention versus providing housing one unhoused? And the thing that I want to address before I pass it on to Hillary, if we can talk kind of numbers, um, is the impact of the individual and to our community, and the difference between prevention and helping somebody when they're already unhoused is like just astronomical. It is an extremely life-changing, traumatic experience to spend even one night homeless, let alone kind of ongoing and trying to get back into the affordability in the Bay Area or anywhere in this country. So anything we can do to prevent that trauma to people, individuals, families, children, I think is an imperative on this community. I'll pass it to you, Hillary, to talk about just kind of the numbers.
Thanks, Chad. Yeah, I think ultimately we go primarily to what you just said in terms of both the financial and the very human cost of homelessness. Our study does show that every dollar spent in homelessness prevention earns communities $2 to $3 in benefits. And so I think what we see is that, spending $6,000 per household or $7,000 per household to avoid homelessness is far less expensive than the cost of providing them with shelter, the cost of all of the wraparound services that come with that, and then the cost of, if we're lucky to find them a housing subsidy in one of our developments that's coming online, et cetera, et cetera. I also want to remind folks that Destination Home did an amazing study quite a while back, Home Not Found, in terms of the cost of homelessness. And it's still very relevant today. And so maybe we can put that in the chat as well. But I think we have to keep that in mind in terms of avoiding kind of the costs to the system, the costs to health, the cost in terms of mental health, family disruption, all of the above.
Can I add to that, Chad? Because one of the things in like brass tack numbers, it's anywhere from $4,000 to $6,000 per month to house someone in the interim system, compared to a $6,000 investment for the totality of the year over 12 months, as Aaron was indicated. So if people are saying, I'm going to do a comparative analysis, it's usually $4,000 to $6,000 or a one-bedroom voucher, which could be $3,000, $4,000 per month. And that's the real numbers that you're managing against. And the system has to catch the cost regardless. So it could be additional EMS services, additional cleanup versus that initial investment.
Awesome. Thank you. That was a really great positive note to end on. We are at time. I just want to thank our panelists. Everyone did an amazing job. I really appreciate sharing and for your time, but most importantly, for everyone who came and attended, listened, engaged, asked awesome questions. I know we didn't get to every single one of them, but I believe we're tracking them. We're going to try our best to kind of follow up. And hopefully we've put some links in the chat that you can kind of follow up and learn more. Again, like if you are working or living in Santa Clara County, like feel hope and pride in the fact that we actually have a working model, that we have cross-sector, public-private partnership support that's been ongoing, because we're going to be up against it in other realms. And so like, let's hold on to this and work together toward the future. Thank you, everybody.